Hi, I'm Dr. Thineshchandar Andiappan. I'm an orthopedic surgeon from Chennai, and let's discuss that why do Indians sit and get up like their grandparents at their 40s. Remember the last time when you had to sit on the floor, the temple that you visited last time, the wedding that you went on, and you had to sit on the floor just to do some basic activities. But getting up is a real problem. You are looking around for people who's going to help you get up. You need that extra support, a cousin who may be stronger than you, who can actually pull you up from the floor. Now, this is how age decline looks like in your 40s. In your 40s, the most simplest task, like getting up from the floor or just getting up from the chair, needs support. Earlier, we used to get up from the floor with zero support, just with our knees, our ankles, and our hip joints. And our spine takes up all the pressure and makes sure that we are upright. But now, you need a support on your hands. You also might need some support for your back so that you can get up easily with less effort. But that is how age decline happens, and you don't even notice it. When we start noticing these problems, it's already too late. But this is how every Indian is aging, and this is where things are getting more serious. You know that things are serious when your knees start talking to you. Yes, your knees can actually talk to you. That krr-krr kind of a grating sensation when you wake up in the morning from your sleep, that is early signs of arthritis. You get up from your sleep, you start walking around, you feel like a newborn calf that struggled to just wake up and just stand up. That is what real decline looks like on a daily basis. And then we go and sit on our bathrooms for about 15-20 minutes with our phones in our hands and making sure that we are updated on the daily news. But then 15 minutes later, just getting up from the toilet becomes the most difficult task, and you could feel your muscles screaming and crying in pain. But you know what? It's normal. That's what we have been always told. We joke about it saying that, oh, it's just age. I've become 40. This is supposed to happen. You know what? It's not. It's absolutely not supposed to happen. In our 40s, we are supposed to be happy, vibrant, traveling, trekking, and doing as much as we can. Because when we hit 60, that's when you start giving the reasons of not moving better, of trying to escape things, and trying to find the most comfortable lives. But at 40, reasons like these is where decline happens. And that is how the starting of every other problem starts. But let's see the real truth of what's happening inside your body. As an orthopedic surgeon, I see patients over the past 10 to 15 years. I've been following up them on a regular basis, and I know how the decline happens. Someone who I see at 30s, when I see them at 35, they either put on weight, they come with back pain problems, they come with difficulty in mobility. They find ways to escape doing just regular things like traveling, or even just doing basic things like walking, cycling, or jogging. Gym becomes one of the most difficult tasks for them because every pain, every workout, every strain that you do on your legs, on your knees, puts strain in your mind and on your bodies. So that is why many of them stop exercising altogether. And this is where the real problem starts. As we age from 30, we start losing about 1% of our muscle mass. And as we turn 40, it increases to 1.2 to 1.5% every single year. And there is where the real problem lies. Muscle weakness leads to inflammation of the joints because the joint goes through a lot of stress. And this is where you start experiencing mild pain and difficulty. Each and every difficulty, each and every single day adds on over years and years. And that's why many people come in their mid 40s and 50s with knee pain and back pains. Every knee pain and back pain is a sign of arthritis, either for your knees, hip, spine, doesn't matter. Any pain in a spine can actually cause knee pain. At the same time, any pain in the knee can cause spine pain also. So everything is interconnected because your whole body is one. Every time your knee hurts, you avoid your stairs around you. And that's how you start developing more mobility issues. Every time you reduce your mobility, your spine starts getting affected. At the same time, your hip joints, your ankle, and your whole body gets affected. The more you start putting on weight, the more pressure your joints takes. And because of that, your muscles are overworked on a regular basis. By doing this over years and years, you start seeing aging really happening inside your body. Many people brush it off saying that it's normal aging, but you know what? It's not. Imagine you having a car. You haven't serviced it for over 5 years. Do you think your car is going to give you the best of what it can? Absolutely not. You need to service and maintain it on a regular basis. And that's how our body also works. If we don't maintain it over every single day, by what we eat, by how we move, by what muscle we strengthen, and how our daily activities are, we are literally ruining our bodies. And this can be seen by the time we reach our 40s and by 50s. And each and every time that you pick up your child, the back pain starts crawling back. And to avoid the pain, what do? You avoid picking them up, you avoid playing with them. You are always hesitant towards any kind of activities that might need a lot more physical work. At Apex, that's where we think differently. We don't ask you where your pain is. We start seeing that where your deficiencies are. Where are you finding problems? Is it due to mobility? Is it due to daily functionality? Or is it just because of how much your body weighs and how much your mental clarity is? Because our end goal is not just to relieve the pain. We are focused on mobility so that you can walk comfortably, you can run, you can play, and you can live a life that can give a lot more meaning than what you're living right now. Because mobility is longevity, and that is what we really truly believe. So if your body is negotiating with you, crying in pain, or just telling you these signs that you need to start taking care of it, please do not ignore it. Please do not normalize that pain is something that you have to go through. We are supposed to be living a pain-free and a happy life. Every single pain does affect us mentally and physically and also socially. Because you are supposed to be moving freely and comfortably and not just thinking that getting up from the floor is going to be the most difficult task of your day to day. So reach out to us if you are going through similar issues and we'll be able to help you out so that you can live longer, better and risk-free.